following portion of Daytime Tri-Cities is sponsored by State of Franklin Healthcare Associates. Once again, it is time to meet your provider with State of Franklin Healthcare Associates, and I am joined today by Dr. Mark McCommons. How you doing, doctor?
I'm doing great, thank you.
Let's talk about, you're a hospitalist.
That's correct.
Talk to us, before we get into the whole hospitalist side of things, talk to us what brought you to State of Franklin Healthcare Associates.
Well, I think fate and God brought me to East Tennessee, a place I wasn't born, but a place I love and now call home. I left home in Maryland and was educated and trained in Richmond, Philadelphia, and New York City before realizing what I really wanted in life was some tranquility. I looked around, and when I saw the opportunity to come to a beautiful land a stone's throw from the Appalachian Trail, I was hooked. I've since married a lovely woman who's the salt of the Tennessee earth here and never plan to leave.
Nice.
I'm very fortunate that I became a partner at State of Franklin Healthcare Associates, an organization that values its patients as a whole person, deserving sympathy, care, attention in their times of greatest need, but that also strives to try and keep people healthy and not get sick.
So, doctor, what initially led you to become a doctor?
I was always drawn to science, but found myself with grant money for research in college, spending a great deal of time in a laboratory, and the conclusion of several years of research was essentially nope. So I thought about what could help me fulfill that calling, and medicine made a lot of sense. I trained at Temple University and then in radiology, but I thought I wasn't connecting on a personal level with people. I finished internal medicine residency here, briefly began training in pulmonary and critical care, but given that it is difficult to develop good relationships with folks on breathing machines, found myself drawn to being a hospitalist, where I can comprehensively care for a person while also being available in their time of greatest need when they're really ill.
Right. What is a hospitalist in layman's terms?
A hospitalist is someone who only does care in the hospital. We are boarded in internal medicine, sometimes family medicine, sometimes maybe some other things, but we don't spend any time in the office, which allows, in this organization at least, for people to be really dedicated to where their patients are at.
Would you say you do the same kind of things that a primary care doctor does?
Well, what we do during the day is a little bit unpredictable by nature in the hospital. So we react to any crisis while rounding on our patients. There's no appointment times, which means you have to take every day as it unfolds and do the best you can for the people depending on you.
Do you enjoy that aspect of it? Because it seems like it would be something different every day.
It is. I do enjoy that. I don't enjoy when people are having a crisis,
but you're there to help them.
I do like the fact that I can be available for that.
Talk to me about, you mentioned your wife earlier. Talk to me about the things that you all do outside of, things that you do outside of work for fun, that you and her maybe enjoy together. Talk to me about like hobbies and things of that nature.
Sure. My wife, Camelia, who is also a nurse practitioner for State of Franklin, is the love of my life and my rock. We currently have a new adorable puppy named Bilbo. He's a very small dog with a very big heart. We are very big on fitness and enjoy spending time wandering this beautiful countryside and the world. We actually just got back from the Bonnaroo Music Festival, which I'm happy to report is an absolutely lovely way for a 40-year-old to spend their time, even if I blistered my feet dancing.
So dancing like nobody was watching.
That's right.
Okay, very good, very good. I love the fact I'm a huge Lord of the Rings fan, and I love the fact that your dog is named Bilbo. Exactly. I love that. But get back to the professional side of things. As a hospitalist, State of Franklin is actually coming out with a new membership card program, and we've got one right here. What is this membership card going to mean for your patients?
These membership cards are intended to aid and enhance people's healthcare experience anytime they visit a urgent care specialist or an emergency room. Presenting this card will ensure their records are sent to the fax number on the card so that their primary care provider is aware of all medical concerns outside of their office. If someone should need to visit an ER, the member card will advise them that you are a State of Franklin patient and wish to be seen by a State of Franklin hospitalist who will ensure your care is excellent.
And being having access to that information at all levels within State of Franklin Healthcare Associates, vitally important for the overall care of that patient.
It is. Disjointed care where people are treated in a certain time period and then forgotten until a later date is one of the biggest ways that we create medical error, waste, and unhealthy patients. Having a direct connection and quality of care that runs between our outpatient providers and people that need to be in the hospital is crucial.
And want to make sure that that crucial care comes at all costs for those patients of yours.
That's right. Yeah. Now, sometimes it's difficult when you're having an emergency to remember different things, and this card is there in your wallet next to your insurance card to help you get connected to the right people.
All right. Dr. Mark McCommons, thank you so much for taking some time with us today.
Thank
Folks,
you.
That is this week's Meet Your Provider with State of Franklin Healthcare Associates. The preceding portion of Daytime Tri-Cities was sponsored by State of Franklin Healthcare Associates.